So let's talk about mold, because it seems to be this hidden one. And it seems to be the culprit that's causing this POTS syndrome and mast cell activation syndrome. And I'm on all these, Facebook pages, and people don't get it. That's probably the underlying cause, are these overwhelming mycotoxins, because they can't clear unless you use itraconazole.
This is the Home of Healthspan podcast, where we profile health and wellness role models, sharing their stories and the tools, practices, and routines they use to live a lively life. Dr. Soernssen, welcome to the Home of Healthspan podcast.
Thank you. I'm excited to be here. I can't wait to see what we talk about today. This is going to be exciting, and I'm going to learn just as much, I think, as I'm going to be able to share to other people.
Wonderful. Yeah, I am looking forward. I have some very specific personal questions that hopefully will be relevant to the listeners as well. So I'm very much looking forward to it. But before we jump into that, how would you describe yourself?
I'm a lively healer. I think from a little girl, I always wanted to help people of all ages. And I definitely, I'm doing that right now. I started with my own family and friends, and it's sort of expanded.
Amazing. Okay. Yeah. I mean, can you say a little bit more about that? So starting with your own family and friends, what do you mean by that?
Oh my gosh, I have so many testimonials to share with you, so many exciting things. My own story. I was sick for 9 years, like sick. When I got out of bed, my head was banging, my joints hurt, I was fatigued. But before that, I ran marathons. Before that, I did shows, was on stage, bodybuilding. And so I couldn't quite figure out what was going on. But it turned out that I was working in a moldy environment at the same time that I wound up getting a tick bite, being treated for Lyme, and never got better. I just never got better. No one could help me. At the time I was in healthcare, I was a nursing supervisor and an educator working in a trach and vent facility. As you can imagine, it's very, moist in there. And I can't imagine any facility being without mold. But this particular facility was built in an age where they were just discovering how to make things airtight. And it was a terrible situation. So a lot of the people were sick that worked there. And there was always buzzwords talking back and forth about, who had what and what was going on. I never put it together. I didn't put it together for 9 years. And I kept thinking I had chronic Lyme. I kept treating my chronic Lyme. Well, here I was working in family medicine towards the end of that 9 years at Cooper as a family nurse practitioner. And I wasn't able to help any of my patients either. I was juggling 19 different medications. Nobody was really getting better. I knew, though, Andrew, there was something to do with the way they ate, right? Because whenever I ate super clean, I felt my best, which is still not good enough, So I left traditional medicine and I got functionally trained with the IFM, right? You're familiar with them.
Yeah.
And opened up my own clinic. And I've been anti-aging at the cellular level ever since. And I've been able to peel back toxins and replacing and replenishing the electrons around cells, which, frees up all the free radicals, and people are getting better. And it's that same process that I was taught in functional medicine, but the end game is different for everybody, right? And in the meantime, people are different. They express things differently. They express oxidative stress differently. It depends on their genetic pathways.
There's a lot I want to dig in on there, but I'd like to start with the mold toxicity piece.
Sure.
So I have had GI issues as long as I can remember, right? At least 3 decades, maybe more. And my sister does, and my mom does, and all her siblings do. And no one's ever, my mom was a physician. She was a pediatric hematologist oncologist, not like she's not trained in medicine, but nobody's ever been able to figure it out. And I started working with a functional medicine doctor, and we had layered on a mold test as part of the function. And it was like there was a toxic level, and then mine was 10x that. And in Bermuda, it's incredibly humid, which can be good for your skin, but the house is, it's bursting out. Every year you have to scrape the paint and then repaint because there's just mold coming in all over the house. And my daughter is having lung issues now. And what the functional medicine doctors share with me is it's something like 70x% of people can clear mold from their system, but there's some percentage, like 22% or something, that it's like a genetic defect. You just can't clear it. And so there was one thing of maybe being in the environment, but that may have been like the tipping point later. If I've had this issue kind of my whole life and my whole family does, maybe there's all mold in most people's environment, but at a certain level, the normal person can clear it.
So I don't agree with that one gene theory. In our clinic anyway, we do a test called 3x4 genetics that tests about 156 genes that have to do with the way your body handles detoxification, methylation, and inflammation. So I think it's lots of genes. The 5-MTHF jar gene is not the only gene out there that has to do with methylation, right? You've got the COMP gene that has to do with, secondary detoxification. And I think that if you are deficient in some of those pathways, you really do need to help support it with some sort of supplement and lifestyle change in order to be able to clear the toxins. So I don't think it's any one thing. So I thought that I originally had chronic Lyme, like I was saying. Well, fast forward 9 years later, after I tested my gut microbiome, I found out that I had small intestinal bacterial overgrowth. I still didn't make the connection to mold. It didn't come up yet.
That's SIBO?
Right.
Yeah.
And so when I did fix my SIBO with metronidazole, on day 7, Andrew, my legs woke up. Wow. I was able to go outside and play soccer with my family, and my life just changed from there. Whereas before, I couldn't even walk up the end of my street. And now remember, before that, I was a marathon runner. So this shouldn't have happened, right? So I peeled off some endotoxins, and that's one layer. So we have so much oxidative stress. It really does start with infectious disease. You've got bacteria, you've got fungi, you've got parasites, you've got viruses. And most of them are in your oral gut microbiome. And we're eating crap filled with pesticides, herbicides, glyphosate. My husband's glyphosate was through the roof, and plastics and everything else. And then you're breathing in all of the toxins, plus the heavy metals that really can't be cleared unless you chelate them out, right? And then the mycotoxins. So let's talk about mold, because it seems to be this hidden one. And it seems to be the culprit that's causing this POTS syndrome and mast cell activation syndrome. And I'm on all these, Facebook pages, and people don't get it. That's probably the underlying cause, are these overwhelming mycotoxins, because they can't clear unless you use itraconazole. So there are urine tests out there. I don't use them. I don't want to know what your body is clearing out. I want to know what's in there, what's stuck in there causing your problem, like the gliotoxin that caused 5 lesions in my brain. So there is one test called my MycoLab, and is the only one that the CDC recognizes. It is a blood test. So when you order the kit, you do have to have someone with a centrifuge be able to draw it down, draw off the serum, and then send out the lab. And it takes about 14 days to come back. But it's not measuring molds. It's measuring your body's IgG and IgE response to the mycotoxins that the environmental molds you're breathing in are causing. So we have mold all around us, right? There's mold outside. It's free flowing. The spores are not really, those aren't the ones that are dangerous. It's the environmental molds caused from water damaged buildings, moist places, maybe pool areas. So the bigger the pool area, the better. I know I had concerns because my son also swims. And, obviously that's a concern for me, but I love the sport. Until recently, he decided he's going to be a Messi, and now he's just soccer. So I don't know. I'm going to beg for him to at least do summer swim. But so it really is in what's you're breathing around you and where you're sleeping and where you spend the most time. Because we know that there's at least 14 that are really detrimental to humans. They're carcinogenic. They attack your glio cells. They're really bad. And so you're measuring mycotoxins, your body's IgG long-term response to creating IgG or immunity, antibodies per se, against these mycotoxins. And that's really the only test that I use.
Can I ask, the test itself, It's a blood draw, or what? How do you do the test?
It is a blood draw. It goes into a serum separator. We centrifuge it down, and then we pull off the white part, the plasma part, and that's what gets sent out to the lab.
Okay, so then this is the identification side. So first we identify, then I guess there needs to be the treatment protocol from there. And so what does that treatment, and then finally, I'd like to get back to prevention going forward. So you got all this, we got it out. How do we not get it back in again? Because we don't want to have to treat stuff constantly. We want to just be healthy. So, but let's start with the treatment. Let's fix, once we have the problem, let's fix it. And then let's talk about how do we stop getting the problem again?
So I've tried other protocols with patients before, and this was before I knew that mold toxicity was even a piece of the puzzle with me. Okay. And so they didn't really work. The binders, the herbs, it didn't really work. Some people felt better because they were feeling better from pulling off, I think, other endotoxins or other types of toxins, but it doesn't work for mycotoxins.
Yeah, I used cholestyramine.
That's a bile type of, kind of like a charcoal or a binder, right? And it's more safe than using charcoal per se, because you're not going to really bind up a lot of the heavy metals that you're consuming, because you have to be careful with that, right? You're going to have to replace that. But you're also binding some other key things. Like if you're on expensive supplements and stuff like that, might not be worth it. Mm-hmm. But to truly get rid of the mycotoxin, you have to kill the spore, okay? So the spores that you're inhaling, they're 2 microns thick. Your hair is 100 microns thick. The spores are like seeds. When you were little, or maybe now, you blow on a dandelion and the seeds go everywhere and you make a wish, right? So these spores are being generated from these environmental molds that are 2 microns thick. Attached to that is a mycotoxin. The mycotoxin that they're throwing off, they're 0.1 microns thick. That's the size of the COVID virus. Okay, you can't get rid of or clear that mycotoxin unless you kill the spore. You kill the spore and the mycotoxins stop producing and they disappear, and you can clear them without binders.
And they reproduce in your body if you don't kill them?
Yes. So let's start with that, because even though I was, let's go way back. My first migraine was at 5 years of age. I grew up in a Collingswood home with a terrible basement. Then we moved to a terrible basement again, old style, Yardley, farm home. Okay. Moved out of that. I realized and recognized that every single thing I ate from a box bag in a can would trigger a migraine, specifically Campbell's soups, everything. So that's how I managed my life. And I was able to run marathons and get through. It wasn't until I was retoxed, spilled over, right, at the age of 39, 40, right after having my child, got bit by a tick all at once, new job at this facility with really bad mold. I have pictures. It's terrible. I'll show you off camera. So anyway, I'm still trying to get nurses out of there to this day. They're also
anybody out of there. Get everybody out of there.
Oh, believe me, I'm trying. Yeah. When I realized that mold was even a piece of the puzzle, I started looking at other ways, because nothing was working. And I was trying everything holistically, whatever I could find, all of the protocols. I ran into Dr. Campbell, super smart toxicologist, been around doing this for 30 years. He's over 80 years old. He has his own podcast, My Myco Lab. And everything, he's science-based, which I appreciate. I still work for Rutgers Institute. I teach and big on studies myself. So I was impressed by the data that he showed. Itraconazole is an antifungal, but it's the only one that kills the whole spectrum. So you got this fungi spectrum. Yeasts are single cellular over here. Molds are multicellular way up here. And they can actually have biofilms. Okay, so itraconazole is the generic brand name, but the brand name is Spornox. It's been used for so many years. It's very safe, but it takes about 6 months. 6 months. Now, other mold protocols take years. Years. before someone is completely cleared. So 6 months of that with some specific supplements to remyelinate your sheaths, because gliotoxin, like the one that I had, that's what gave me my 5 lesions in my brain. Hopefully, I'll get a body scan next year and they'll be poof, gone.
And it's a prescription?
It is.
Okay. And so you need to be working with a physician that understands this, knows how to measure it, knows how to do the test.
Absolutely. Because every 6 weeks, you really need to measure your liver enzymes to make sure they don't get elevated.
And what would be elevating them?
So the drug can stress out the liver. However, if you're eating cleanly and you're on the right supplements, you don't eat the crap, liver enzymes never go elevated. They're never elevated.
What kind of supplements?
So particularly vitamin C to help redox the cell. I'm sure you've heard and talked a lot about that on your podcast before. Melatonin, because it's neuroprotective, only 3 milligrams at night. Okay. Phosphatidylserine is another important one because it helps not phosphatidylcholine, but phosphatidylserine. There's a lot of data that shows that it can remyelinate your sheaths.
Oh, wow.
To help, reverse some of the damage that's been done. Okay. And of course, your B-complex methylated vitamins to help your body. Vitamin D3, because it's an antimicrobial peptide, super important in immunity. Certain spore probiotics that help fight against the bad yeasts and molds, because you do have some yeast along with the mold that's colonized in the gut. Because you see, once you breathe in these spores, even though you're out of the environment like I was, I still wasn't better because I didn't kill the spores that were colonized.
Right. You're carrying it in you. Yeah.
Right.
That's kind of what I'm bumping against. Okay.
I'll tell you what, in 5 days, my nerve pain went away down my arm. 5 days on itraconazole.
Itraconazole. Okay. This is selfishly very, very helpful. Okay. Thank you.
I really think it's a hidden problem. I think people are dealing with quote unquote chronic Lyme. I don't believe there's chronic Lyme. I think they're just overspilled with toxins and they have to pull off the heavy metal. They have to pull off the mycotoxin. That's what's preventing them from redoxing the cell and feeling themselves again. I have a couple that I'm working with in Arkansas. I got a license in Arkansas just to help this couple out. They were friends. They were living with me before in Tabernacle in Southern Jersey. I don't know if you know anything about that area. Had a bad basement. I believe they were both mold toxed back then. But anyway, we got reconnected about a year ago, even though they moved 10 years ago, way out there, right? They built a new home. I saw her stuff on Facebook. I'm like, and I'm allowed to share her name. They're shouting my name everywhere. Her name is Carol. Carol, what's going on? And she says, oh my gosh, Davina, I'm on low dose naltrexone every night. My joints hurt. I no longer can teach yoga. I've had my breast implants removed. I still don't feel better. And Bill was diagnosed with Parkinson's disease and started having seizures 3 years ago. And I said, Carol, you know what I do for a living, right? She's like, no, what do you do? So I started to tell her about the practice and how we pull off toxins and we, find it, and everybody's a little bit different, but we'll get to the bottom. We'll get to the root causes and we'll help you out. Their mycotoxin levels were really high. She also had a high lead. Okay. She wore a lot of red makeup. There's a lot of lead in red makeup, but also she was taking, and I don't want to call any one company out or whatever, but there was a certain Celtic form of sea salt that had a higher amount of lead in it. Oh, yeah. That could have contributed to it. We're not really sure. So we did chelate her, but we started itraconazole on her. And she said to me the next day, Davina, I don't know if this is placebo or real, but I already feel a little bit better. I said, no, it's real. It's real. Just hang tight and wait to see what Bill says in 5 days. He's not going to be able to put his finger on it, but he's going to feel better. In 5 days, his Parkinson's movement stopped. Wow. They're almost at week 12 right now. He's fly fishing. She shared with me a picture that her trigger finger is completely open and they're feeling better every single day because of the itraconazole.
Most corporate wellness programs overwhelm employees with too much, or they offer too little to be useful. Lively gets it right. We start with each employee's data and goals, then serve one clear, personalized action at a time. No noise, just real behavioral change. The outcome? A healthier, happier workforce and measurable impact for your business. Visit alively.com to see personalized wellness in action.
Yeah, I want to share this with my father immediately. I mean, he was a pediatric cardiologist, but just relatively recently, the past few months, I mean, he was running half marathons. He was running every day. He was addicted to it. Now he's just in so much pain. His leg, he can't kind of sit. He's massaging his leg all the time.
Please, I will talk with him anytime, and I'll share with him so many more testimonials. They're antidotes, right? But I'm compiling them, and I'm starting to look for places to publish because I've got a ton.
You kind of need the anecdotes before you get to informing what clinical studies do in the first place, right? I mean, this is the other side too, because sometimes it doesn't work for the average, right? I'm trying to, like ketosis, for example, for some people, it's like, it's super impactful for 20 to 30%. But if you go run a study, it's going to say, oh, on average, it's not doing anything. But there's this certain group that it is magic for.
Right.
And so there is something to at least trying something. If it's not going to cause damage, saying, hey, if you're having this problem, try it, see if you get the benefit. Because who cares what the big study says?
And there's a big spectrum of ketosis too. You know, you can stay in this little nutritional ketosis is where I like to live. I don't go over 2. Like I'm like low. You know, I don't eat sugar. You know, I eat berries or my form of sugar and green leafy vegetables. That's all.
Yeah. I mean, I'm the same. I eat plants. That's what I eat. Yeah. So it's pretty straightforward. Okay. So this is treating once you have the problem. So say you have cleared it, you've treated it. How do you help prevent yourself from getting retoxified, if that's a phrase?
Exactly. So it's a little bit of a witch hunt, right? And this is where I do a lot of hand holding because, you know, let's say the wife is sick, but the husband feels fine because, you know, it's sneaking up on him and he might just have a heart attack down the road and not ever know what the causes are, right? But she's super sick because she's spilled over with all of her toxins. And it's really this master bathroom that has not been renovated. And they think that's the problem. Well, then you have a company come in and the air quality test that they do in the middle of the room are normal. Okay. Well, they didn't open up the wall. And if you really have a gut feeling that there's something going on with this original bathroom that's never been renovated and you're seeing mold anyway in the shower, open up the walls. You know, get a swab sample. So there's a couple trusted companies that I do recommend to my patients, but they really have to figure out where the mold was. It could be at the gym that you go to every day. It could be at your work. It could be in your car. If your car's ever flooded, if you have a Jeep and, you know, it rained inside your car, it could be under there and you're in contact with it every day. I mean, I was sleeping, you know, in my bedroom with our master bathroom that I didn't recognize was a problem, you know, and it was.
It's chronic exposure. It's something that would be more in your control, your work, your sleep, your live environment, not going about your day normally, just like walking through the street. Okay.
Correct. But I will tell you, people that are on itraconazole for treatment for mold toxicity, they'll walk into a room that's a musty smell and have symptoms immediately.
Wow. Okay.
And they know there's something wrong with the room and they need to leave. It's this phenomenon I can't figure out, but I've heard it.
You become more attuned to it. Okay. Interesting.
So now my son, my 12-year-old, last March, he started exhibiting tics. And my husband literally fell to his knees, fix my son, fix my son. I said, Paul, we know how to fix pandas. Like, let me look and let me see if there's some strep going on. He used to get strep all the time. I proactively couldn't find it. But I proactively did put him on doxycycline, and then I rebuilt his gut. And 99% almost of his tics went away. But occasionally I would see him lifting up his hands if he was on his way to swim practice or something like that and thinking or a little bit nervous about, you know, performing. And so it started to get me to think more. Let me look at this master bathroom. And that's when we discovered it was in the master bathroom. And now he's on itraconazole. Tics are gone. They're completely gone.
That's incredibly helpful on the mold toxicity. If we could take one step back to, you referenced like cellular health and kind of treating that. And at some level, a step back, they're the point solutions like the mold toxicity or things you may have. But overall, we're trying to get this high performing mind and body and everything and up our energy levels. So what are you most excited about in your practice that you've seen kind of unlock that for most people outside of like eat well, get a good amount of sleep, move your body vigorously, the basics. What are the things on top?
So because oxidative stress is the reason for disease, right? Peeling off all the places that you can possibly peel off first, because if I'm trying to help you get better with any kind of treatment, you can't still be in the shower while I'm trying to dry you off. You're just not going to dry off. You're just going to be wet, right? So you really do have to remove all the toxins from their life, all the toxins from the environment, find out their triggers, get rid of them, and then you have to redox the cell. So how do you redox the cell? Vitamin C is literally inside your cell for a reason, because it's capable, and you know this, of donating electrons, but it can also take them away, and it knows when to do it. That's the fascinating part about vitamin C. Whereas astaxanthin donates, it can't make the switch, but I love astaxanthin for other reasons too. So high dose vitamin C infusions are in our clinical practice. At that level, they can be pro-inflammatory, so you have to use it on the right patient when, but I always tell my patients to please redox your cell with vitamin C, 3 grams a day. Use the form with flavonoids so you're not going to get the gastric upset. Okay. You know about the guinea pigs and humans and how we can't make vitamin C anymore, right? We require it from our diet.
Okay. No, I didn't realize that.
We can't make vitamin C. We lost the ability thousands of years ago, probably because we were getting it from green leafy vegetables. Well, we're not getting it anymore. Look at our vegetables. I mean, I buy organic, but look at them. Yeah, they don't have exactly what they used to have. They did a study on guinea pigs. They gave both sets scurvy. They removed their vitamin C. Both groups had scurvy, okay? One group, they gave back vitamin C, the powdered form that we typically find in a typical vitamin, and their scurvy got better. But their hair wasn't glistening, and they weren't rambunctious, and they weren't healthy looking or appearing. But then they gave pomegranate, the whole form of vitamin C, to the other group. Not only did the scurvy get better, but they were glistening and they were well.
You think it's the ubiquinol as well in that? Or is it ubiquinol or is it urolithin A? What's in the pomegranate?
There's probably lots of things in pomegranate, right? So you need those flavonoids. They're flavonoids. So if you take vitamin C with flavonoids, you'll avoid the GI upset. So you can take 3 grams. You can take 1 gram 3 times a day and not have the problem. But the best form is really liposomal. I love the brand Live On, because that's what the Royden Clinic always says for their patients to use when they're not getting their IV vitamin C on the days off. So I always recommend that one. Okay,
so vitamin C with the flavonoids, that's one you're very, very excited about.
It grabs toxins. It neutralizes. I think there's a guy I heard that goes out on stage and he takes deadly forms of mushrooms. And then he takes vitamin C and doesn't die. I got to find that. I'm going to send it to you. I mean, I would never do that, right? That's pretty crazy. But that's powerful. That's a powerful statement of what vitamin C is capable of doing. And if it can pull out toxins of your body, or neutralize toxins is how I should put it, then I'm taking vitamin C every single day.
Yeah, in case anybody tries to poison you with mushrooms, you'll be ready.
Right.
So what else? So vitamin C, high dose, anything else that...
Magnesium, and I know. Yeah. There's more than 3,000 receptor sites that we don't even know what each one does for magnesium, but we know they're there. And there's over 350 something that actually is responsible for some sort of catalyst activity that's required for us to run right for magnesium. And magnesium, just like insulin pulls glucose inside the cell, magnesium grabs vitamin C and brings it inside the cell where it belongs. I love all 7. So, and it depends on what you're using it for. If you need to poop, you go to the citrate. If you don't, you go to the glycinate. But I use biooptimizers. I love Magnesium Breakthrough. It has all 7.
And do you take it at nighttime? Or when do you take your magnesium?
I do. I take it at nighttime because it does help my sleep. And so I take that, and I take glycine at night, and I take 3 milligrams of melatonin. just for the neuroprotective benefits and the longevity benefits.
And do you have a third? So this is good. Do you have a third that you're saying I'm pretty excited about? I've been seeing in my practice this really help a high number of people?
Yeah. So I don't test everybody's genetics. They can't always afford the type of testing that we do. I prefer to do it that way so I know what they're deficient in. The best supplement is really the one you're deficient in the most, right? And most people, I'm going to say, are deficient in vitamin D3. So that's absolutely key. But I give everybody a B complex that's methylated as well, because I don't know what their genetics look like. And I want to give them the best opportunity to be able to methylate.
And if they don't have that problem, is there any downside risk if they don't have the MTFR?
I think you can probably take way too much. People get overexcited. I know that my autistic children, if you give them too much or too fast of the folinic acid, like the leucovorin that they're approved now, then they can get too excited, right? Okay. So you have to do it kind of slowly.
And that one, do you do in the morning? So I've shifted my B and D to the morning because I was taking it and it was like offsetting what I was doing at night to try to get ready for bed. I was getting more energy.
My face flushes, so I do it when I eat. Whenever I eat, and I don't always eat breakfast. I sometimes skip.
This has been really, really helpful personally for me and my family. So it's funny, we kind of come full circle in that you were saying, hey, you started with yourself and your family. And then now this conversation, hopefully for me, and I can take this to my family and all our listeners, I think there's a lot in here people can relate to and a lot of hope that I think you've given people. And there is a solution. It's you're not crazy. It's not just that you're getting old. It's the problem with your environment. We can fix a lot of that.
That's absolutely right. I really think everything is fixable. Some people are born with a genetic broken mutation that might be really harder to fix. But now, they're using stem cells, specifically mesenchymal stem cells, the kind that go and they sense when things are broken, and they donate, their mitochondria, and they donate their growth factor, and they can tell. We are the most amazing AI technology that I believe God created. And it's impossible. It is impossible for humans to create such an AI technology. And these little mesenchymal cells are like bots. They know exactly what to do. And the easiest way to give them is through your IV, because they go to the area of inflammation first and go to work.
Yeah, the NI, the natural intelligence still beats out that AI. Yeah, we probably should do a follow-on deep dive on that, because I think that is going to be an incredibly promising area going forward. Yeah.
Super exciting. So many things happening with mesenchymal stem cells, and they're legal. People just don't realize they're legal in this country. You don't want to go outside the country because you're going to get the chemically altered ones anyway. They're not naive. And then you run the risk of having those HLA2 tags where, you're going to reject them.
Yeah, you hear some horror stories of that, people. Yeah.
But you can't reject these naive ones. Like, I could have a baby for you, Andrew. You could give me a sperm and an egg and put it in my body, and I could grow a baby. The baby would not reject me. I wouldn't reject the baby. Those mesenchymal stem cells are what's actually modulating the immune system. Oh. They're treating rejection. So cancer patients and leukemia patients who have had bone marrow transplants from older adults, they have HLA2 tags. So now they have to find a close match or there will be a rejection.
Right.
Where some, people get stuck in a cycle, and they can't get out of rejection. So guess what they're using? Mesenchymal stem cells to get them out of rejection. So why aren't we approaching cancer like this?
Yeah.
I don't get it. And it's not expensive. You could spend a lot of money outside the country. I'm not saying they're cheap. It costs $1,300 for one unit for me to purchase a quality 10 million cells, but it's so worth it.
And so what is an example treatment where you say, hey, this is what it's used for. This is how we do it. This is what it costs. This is the results.
Right. So I believe they can be used almost for anything, and they're studying it for longevity, living longer, RA, rheumatoid arthritis, congestive heart failure, everything. Even when I had mold toxicity and didn't realize it yet, I gave myself some stem cell infusions and it overcame it for months where I was superhuman again. So it's really one unit for every 60 pounds of body weight is how we dose it. intravenously, but there's other ways of getting it. You could directly inject into a knee or a shoulder, or even IM to a child who's afraid of an IV. It's an easier way to get into a child with autism.
Wow. And then how quickly do you start seeing the results?
3 days.
3 days. Okay.
3 days, you start to feel energy.
They last for how long?
Months. And it depends. So just like I was telling you before, how good is your environment? Because stem cells are going to thrive in a really great environment. So we prep all of our patients first, and we do look for all the toxins first, and we do get their gut straight, and we get them on a good diet and all the right supplements for them before we even do the stem cells. Now, some people want to jump right to it if they've got a bum knee and it gets them over, that hump and they're fine. But, it's not going to do as much good unless the environment is nearly perfect for them.
And this is a thing that, all across the country, you can find practitioners, providers that are able to do this?
There are a lot of practitioners doing this in California right now. We get ours from Chara Core Biologics. That's where I was certified to do the infusions. And I was using some other sources before. I can tell the difference right away. They're very high quality. So you really do have to do your research and make sure you're getting a really high quality brand.
And then, I guess it depends what you're doing. You say it lasts months. So do people typically do twice a year, 3 times a year, like depending on what they're trying to address?
For myself, I'm just maintaining at once a year. But what we'll do is we'll reevaluate every 3 months. Sometimes people are a one and done. And other times, they might need 2 or 3. I've never given 3. So there's
okay.
that.
Yeah. Okay. That's amazing. Okay. So never 3 in a year or never 3 total? It's like after
never
the 2.
3 total.
Wow. Okay. Okay. So that it could last potentially years as well.
Except for myself. This will be my 3rd this year, just because I want it.
Yeah. It's a little easier for you to go do it. Yeah. Okay. That's really interesting. I want to follow that much more. But back to, I need to get my environment better. So I need to go work on this old toxicity for me and my family first.
Yes, you do. My myco lab.
Okay.
Yeah.
Thank you so much, Dr. Soernssen.
You're welcome. Thank you for having me. This was fun.
This was incredibly fun and informative and helpful and potentially life-changing. So I'm really excited to see.
It will be. It will be. Trust me.
All right. Well, thank you for today and all the work you do.
Thank you. Same here.
Thank you for joining us on today's episode of the Home of Healthspan podcast. And remember, you can always find the products, practices, and routines mentioned by today's guests, as well as many other Healthspan role models on alively.com. Enjoy a lively day.